Hello everyone, welcome to Nursing with Jinsi. Today our topic is roles and responsibilities of a nurse or job description of a nurse. ഒരു നേഴ്സിൻ്റെ ഡ്യൂട്ടീസ് ആൻഡ് റെസ്പോൺസിബിലിറ്റീസ് എന്തൊക്കെയാണ്, അല്ലെങ്കിൽ പേഷ്യൻ്റ് കെയറിൽ ഒരു നേഴ്സ് ക്യാരി ഔട്ട് ചെയ്യുന്ന റോളുകൾ എന്തൊക്കെയാണ്, അതാണ് നമ്മൾ ഇന്ന് ഡിസ്കസ് ചെയ്യാൻ പോകുന്ന ടോപ്പിക്. സോ ലെറ്റ് സ്റ്റാർട്ട് വിത്ത് അവർ ടോപ്പിക്. ദ ഫസ്റ്റ് റോൾ ഓഫ് എ നേഴ്സ് ഈസ് caregiver. Okay, caregiver. We all know that the function of a nurse is to give total or comprehensive nursing care to your patient, isn't it? So in a hospital situation or in a hospital settings, the nursing care will start from the admission department to the time of discharge, starting from admission to discharge. Okay, so what are the functions as a nurse you need to do in your nursing care as a caregiver? Okay, that is the points coming. First one, you have to do primary assessment for your patient. Okay, what is meant by assessment? First, when you are receiving your patient from your admission department, you have to assess your patient thoroughly. For what? You need to give total care to your patient, isn't it? So for better or quality care means you have to know thoroughly about your patient. You don't know your patient complaints, you don't know about your patient history, means you can't able to give proper or effective nursing care. Okay, for that purpose, as a nurse you have to collect the history and collect the present complaints. So under assessment, first one you have to do the you have to collect the present complaints of your patient. Why that particular person now as a patient in your hospital? Okay, that you need to collect. Presently, what are the complaints verbalizing by your patient? Okay, after that you have to assess the present health status of the patient. Patient is conscious or not, or patient have normal vital signs or not, no patient a patient well oriented or not. So like that, present health status of your patient also you need to assess. And second is, after collecting the present complaints of your patient, you need to collect the past health history. That under two headings, medical history and surgical history. This is very important. As a part of medical history, you need to collect patient is affected with any chronic disease like cardiac disease or heart disease, then kidney disease or bronchial asthma, diabetes mellitus, like any chronic disease affected, or he or she is taking any medicine since how many years. Okay, like that matters you need to collect under medical history. And under surgical history, you need to collect about surgeries. The patient, your assigned patient, had undergone any surgery previous years, or how many years before he or she undergone any surgery or not. Like all the surgical history also you need to collect. Okay, next is assist for medical or surgical care procedures. Next one, assist for medical or surgical care procedures. That means now you already collected all the history and your doctor already consulted that particular patient. Okay, of course your doctor orders some treatment options for that particular patient. As a nurse you have to obey that orders of your respective physician. That means you have to carry your nursing procedure for that particular patient, or you have to assist that physician to do some treatment options. Okay, that is assist for medical or surgical care procedures. Next point, maintain accurate records or reports on nursing care. Okay, this is very important function of a nurse. As a nurse, you are carrying all nursing procedure, isn't it? You are doing your nursing care. You are assisting doctors for procedure, assisting doctors for rounds. You're doing assistance for your patient's lab investigation. All those under your caregiving, isn't it? So here All these nursing care activities you have to you have to write and keep as a nurse's records or reports. That's also consider your function under caregiver. Okay, next is medicine administration. That already I told you that assess for nursing procedures or do nursing procedure or assess for treatment options for your patient with the physician. Okay, the next is health teaching. Health teaching means you have to give proper health education to your patient. How you need to give health education or what is the purpose? Okay, you need to give health education or proper health instructions regarding your patient particular disease condition. Okay, according to your patient compliance or according to your patient diagnosed condition, according to your patient health status, you need to give some health instructions to your patient in order to improve his or her health status. Okay, next is psychological support. As an assigned nurse, you have to give your patient good psychological or mental support. What is the need or what is the importance? The importance of psychological support in our nursing care or patient care means sometimes patient or the family members, they may be tensed on disease condition, maybe tensed on hospitalization, maybe they are very anxiety on the surgery about. Okay, so you need to give proper psychological support. Means the patient will understand what is my condition. Okay, this is nothing serious, I will be okay or I will be all right, okay, after the surgery, so nothing to worry. And then what is or what are the medications I am taking now, so what are the actions or what purpose I am hospitalized here, I am admitted here for what purpose, like that. All your psychological support or your education give psychological support to your patient as well as to the family members. That will help for better care also, and that will help to make your patient more comfortable, okay, in hospital settings. Okay, so these are the main points or main functions comes under nurse as a caregiver. Okay, I hope you're clear with the points. Okay, the second role is an advocate. Okay, nurse should act as an advocate for the patient. Under advocate, nurse should carry two type of functions. Okay, two type of activities under as an advocate. The first one, nurse should protect patient's rights. Okay, when nurse giving nursing care to the assigned patient means nurse should protect patient rights. That means nurse should give equal care to all patients. Do not discriminate any patient according to their color, caste, finance, or politics, or religious beliefs. Like, okay, so as a nurse, you consider your patients all are equal. Okay, do not discriminate them. Okay, the second action under advocate, nurse should know all the legal issues regarding patient's care. Okay, പേഷ്യൻറ്റിന് കെയർ കൊടുക്കുന്നതിലുള്ള നമ്മൾ മനസ്സിലാക്കിയിരിക്കേണ്ട ലീഗൽ ഇഷ്യൂസ് അല്ലെങ്കിൽ ലീഗൽ പ്രോബ്ലംസ്, അതിനെപ്പറ്റി നഴ്സിന് നോളജ് ഉണ്ടായിരിക്കണം. ഓക്കെ, ദാറ്റ് ഓൾസോ കംസ് അണ്ടർ നഴ്സ് ആസ് ആൻ അഡ്വക്കേറ്റ് ഫോർ ദ പേഷ്യൻറ്റ്. ഓക്കെ, ദ തേർഡ് റോൾ ഈസ് കോർഡിനേറ്റർ ഓർ സൂപ്പർവൈസർ. What is the meaning of coordination? Coordination means we are coordinating something from others, or we are coordinating something from other places, or coordinating something from other departments. Okay, for example, here in our hospital settings, a nurse should act as a coordinator for the patient or patient care. Means nurse should coordinate all the departmental services for the patient care, or nurse should supervise all the activities, all the care activities for the patient. Means when your patient admitted, that person admitted here as a patient in your hospital, your patient need to undergo some surgery, so OT services, operation theater services needed, and we have to do some lab investigations or diagnostic procedures for the patient. So your patient need laboratory services, otherwise your patient want to take x-ray, your patient need x-ray or radiology departmental services. Okay, so your patient, when your patient admitted already here, means your patient need all services from other hospital department also. So as an assigned nurse, your responsibility is to coordinate these all care services from other departments and effectively give to your patient. Okay, your doctor ordered any x-ray for your patient, means as a nurse your responsibility is to arrange or make a request or give information regarding that patient to the x-ray department and make your patient appointment for the x-ray and send and prepare for that procedure and send that patient to the department and again receive from the other department. Like all these care activities, as a nurse your responsibility, you have to coordinate these all activities and effectively give to your patient for better care. Okay, for the improvement of the patient also. This is the third role, as a coordinator or supervision means you have to supervise or overseeing all care activities and you ensure that your patient getting better care or your patient health status improving or your patient is better than the admission time. Like you have to supervise your patient all care activities. Okay, that is a role comes under coordinator or supervisor. Then the next is next role of a nurse is decision maker. Okay, decision maker in a critical situation or during absence of physician or doctor, nurse can make decision for the patient in order to save the life of the patient or to provide care without any time delay. So here nurse should act as a decision maker for the patient. Okay, decision maker means sometime any critical situation arise, for example any emergency situation that fatal to your patient, very serious, very critical, your patient getting very critically ill. Okay, that time your doctor not there. Okay, so that time as an assigned nurse you should act as an emergency life saver for your patient. You should not waste your time. You just think what I can do as emergency management to save my patient life. Okay, so don't waste your time and just think and do or act immediately for your patient in order to save the life of the patient. Okay, in a critical situation. And also here sometimes some problems arising from patient side or from other hospital departments. So here as a decision maker your role is to solve the problem also. Okay, oversee the problem and try to solve the problem also. So these two functions comes under nurse as a decision maker. Okay, next one is protector. Next role of a nurse is act as a protector. Okay, how to protect your patient? Now your patient is in the hospital, so purely that patient's all care matters responsible by that particular assigned nurse. Okay, so nurse is responsible to give safe and protective environment for the patient. Okay, when your patient already in hospitalization, so your responsibility is to provide all comfortable or safe environment for the patient so that the patient may feel comfortable or a patient may feel I am very safe here. Okay, then to prevent falls or prevent injuries or prevent infections. Maybe when your patient got admitted, that time a patient having some health problems, isn't it? We already collected. So not to get any further problem from your hospital side, okay, as like for example false, if your patient need side rate services, you have to give, and your patient disabled to do his or her self activities, means as an assigned nurse you have to help or assist for to doing self care activities. So like that, as a nurse should act as a nurse, you should give protective or safe or comfortable environment to your assigned patient, okay. That is a function comes under as a protector, okay. Next role is communicator. Communicator means you know what is the importance of communication in our nursing profession, isn't it? You are the center person for nursing care, or you are the center person in patient care, okay. Patient care, you have to communicate with your doctor about your patient, isn't it? You have to communicate with your other departmental heads or other departmental personals about your patient, isn't it? And especially you have to communicate so many things regarding the health matters to your respective patients. So a nurse should not maintain effective communication, means that particular nurse can't able to give proper nursing care also. So as a nurse, as an assigned nurse, means you should keep good communication skills, okay. Then only you can able to give proper nursing care, okay. Nurse is responsible to communicate all the care matters to the doctors or to other health departments or to the patient as well as to the family members. So nurse should maintain good communication skills, okay. Next role is counselor. Nurse should act as a counselor for your patient. Nurse should give counseling to the patient, help to decide the type of care which is needed for the patient, give psychological support or mental support to the patient as well as to the family members. So here also something similar with our health education, okay, health teaching. But more than that, you have to give some advices to your patient as well as to the family members. Maybe they don't know about the what is a surgery plan for the patient, or what is the purpose, or what may be arise as complication, or what is the post procedure care. They don't know anything about. So more than that health teaching, you have to give some advices to your patient to select the care. Some patient may refuse the surgery. I don't want any operation, I don't want any surgical management, I will take medicine, it's okay, like. So you have to give proper advices to your patient to select the care, to choose the services, and you have to give proper psychological support also to your patient for better cooperation, for better understanding, okay. Thereby you can make your patient as very comfortable or very safe in your hospital settings also. So here nurse should act as a counselor for the patient, okay. And next role of a nurse is educator. As an educator, the same functions you have to carry for your patient, that you have to give proper health education. So educator means give health education, okay. That is a function comes under role as an educator, okay. Nurse should act as an educator for the patient. Nurse should give health education, especially give instructions on how to manage their symptoms or disease condition. I already told you in the first under caregiver, you have to give proper health instructions to your patient according to your patient's disease condition, okay. You have to give relevant instructions to your patient, okay. Example, nutrition, nutrition, rest, exercise, about medications, home care after discharge from hospital, and any further about give education about maybe arise any further complications. All these matters, regarding all these matters, you have to give proper health instruction or education to your respective patients. Okay. The second function comes under, as an educator, give training to other staffs and give education or conduct training programs or conduct continuing in-service education programs and to do supervision and evaluation for better care. Okay. So the second function, first function means give proper health education to your patient. Okay. The second function, as an educator, a nurse should responsible to give proper training to other staffs or subordinates. Okay. To other staffs or subordinates, you have to give proper training. You have to do supervision and evaluation. You have to give guidance and direction how to do this procedure, or you did this is wrong, so you have to do like this, or how to manage your patient case, how to do nursing procedures, and how to educate your patient, like that, as a senior nurse. Okay. In every hospital settings, there is one senior nurse and some subordinate nursing staff working under her, isn't it? So as a head nurse or as a senior nurse, your responsibility is to give to do supervision, to give proper guidance and direction for doing better or effective nursing care. Okay. The next and last role is inventory manager. So this is also a very important function or role of a nurse as an inventory manager. So inventory manager, or otherwise we call that as a resource manager. Okay. So what is meant by resource? You all know, for doing any type of task or any type of activities, we need resources, isn't it? For example, in our hospital settings, as a nurse, we want to give nursing care to your or our patients, isn't it? So resources means there are two types of resources we need to give proper care. Which are the two resources? First one is human resource. That means ഒരു പേഷ്യൻറ്റിന് കെയർ കൊടുക്കുമ്പോൾ, ഫോർ എക്സാമ്പിൾ ഒരു പേഷ്യന് വേണ്ടി ഒരു ഇഞ്ചക്ഷൻ ഓർഡർ ചെയ്തു, ആ ഇഞ്ചക്ഷൻ കൊടുക്കുന്ന ആളാണ് നേഴ്സ്, അല്ലേ? ആ നേഴ്സിനെ നമ്മൾ വിളിക്കുന്നത് ഹ്യൂമൻ റിസോഴ്സ്, അല്ലെങ്കിൽ ഹ്യൂമൻ ബീങ് ആണ്, ഹ്യൂമൻ സ്റ്റാഫാണ്. അതുകൊണ്ട് ദാറ്റ് കംസ് അണ്ടർ ഹ്യൂമൻ റിസോഴ്സ്. ഓക്കെ. ദ സെക്കൻഡ് ഇസ് മെറ്റീരിയൽ റിസോഴ്സ്. ആ സ്റ്റാഫ് നഴ്സിന് ഇഞ്ചക്ഷൻ പേഷ്യൻറ്റിന് വേണ്ടി ഇഞ്ചക്ഷൻ കൊടുക്കുന്നതിന് എന്തൊക്കെ ഇൻസ്ട്രുമെൻറ്റ്സ് അല്ലെങ്കിൽ എന്തൊക്കെ മെറ്റീരിയൽസ് വേണം? സിറിഞ്ച് വേണം, needle, syringe, gloves or face mask. These all comes under material resources. So here, as an inventory manager, a nurse should supervise or manage these two type of resources, human resources and material resources. Okay. And after that, what is meant by inventory? Okay. It is the detailed list on all supplies and equipments that available for patient care. I already told you, for example, syringe, needles, or other machines to provide better care for the patient, other equipments. Okay, these all equipments or the materials or the supplies, these all comes under inventory. Okay, so the detailed list on all these supplies and equipments, we call as it is inventory. So as a nurse, you have to manage inventory also for the better care for your patient. Okay, that means manage human resource as well as manage material resources. Okay, so these are all about the roles and responsibilities of a staff nurse while doing nursing care for your patient. Okay, I hope you all are got these points and you understood with the contents. Okay, so once again we will conclude the headings. And this is very important question for your exam as an essay question maybe, or as a short note question. Okay, so the answer you have to expand according to your marks. Okay, so today we discuss about the roles or responsibilities of a staff nurse while giving nursing care. Okay, I will conclude again with the headings. First one, caregiver. Second is advocate. Next, coordinator or supervisor. Next one, decision maker, protector, communicator, counselor, educator. Last is inventory manager or resource manager. Okay, so I hope you all are understood with my topic today's, and thank you for watching.